So we have with us here Ms. Chelauna Providence, the Communications Manager at the Georgetown Public Hospital Corporation, who will give us some updates about what was being done since the first confirmed case of the novel coronavirus here in Guyana to what has been done by the hospital now to be able to tackle the spread of this disease.
So we know that on March 11th, we had our first confirmed case of COVID-19 in Guyana. Unfortunately, the patient did pass here at the GPHC. Since then, we have put several measures in place. One, we've tightened our security to ensure that persons who are coming into the compound, because we are working in a health facility and we need to ensure that our staff are safe and that they're healthy and our patients. So we've increased our security to ensure persons are screened before they come into the compound. We've also set up screening areas at the 4 main entrances of the hospital to ensure that all persons who are coming in to visit are observed, and persons who are coming in for admission or for to see a doctor are pre-screened before they come into the hospital so that we can determine whether or not they're showing any symptoms of COVID-19 so that we can redirect them where they can be appropriately dealt with. We have also been sharing as much information as we can with our staff and our patients and the public about what measures they can put in place to prevent them from contracting or spreading COVID-19. Things like simple hand washing, social distancing, which now we know is highly recommended now that we have confirmed cases in Guyana. And just sharing as much information as we can. Of course, the information is always developing, and we're just trying to put that out as much as possible in the public and sharing it with our staff.
You mentioned screening a couple of times. Can you explain how this screening is done?
So there are, I'm not a medical person, but there is a checklist of some symptoms that medical doctors or a medical professional can look for when persons come to the hospital. They check their fever, they can do basically a medical analysis. Of course, if the person has respiratory challenges, we know for sure that is a red flag and that they should be further screened to determine whether or not those respiratory challenges are being caused because they would have been infected with COVID-19. And so we redirect them to 2 designated areas where we have medical professionals set up to do additional screening to determine whether or not they are just having respiratory challenges or they could have possibly been exposed to COVID-19.
And I've noticed that you also have the hand sanitizer at the main entrance. Is
Correct.
that everywhere? And
we've always had sanitization stations in the hospital. We are working in a hospital, so persons are constantly washing and sanitizing their hands, especially our medical staff, but we advise that all of our staff do it. So we've always had the sanitization station set up in the hospital, but now we can say we've beefed it up because we know now that more people need to do it, be conscious that they need to do it more regularly, and of course we want our visitors as well as persons coming into the hospital who are not necessarily staff to have that facility available to them so that they can sanitize their hands, because anyone who's come in contact with the virus, they can bring it in on their hands, and we just want to ensure that that barrier is there so that they can sanitize before they enter the compound.
we've also had 3 other confirmed cases at the weekend. Can you tell us whether those persons have visited the hospital or how we found out about them?
What I will say is that the Georgetown Hospital, while we have been dealing with the response here, there is a larger unit at the Ministry of Health that has been monitoring additional cases and additional persons, I should say, not additional cases. Those persons did not come to GPHC, but there is a larger unit at the Ministry of Health that is responsible for monitoring the additional cases that we would have seen over the past couple of days.
Can you explain then how did the ministry find out about those cases based on what you understand?
Well, like I said, there are other health professionals who are monitoring. There's monitoring being done at the airports and at additional ports of entry. Some persons have been responsible enough to call the hotline. You know, the Ministry of Health has a hotline. Some people call and they say, look, I am showing some of the symptoms, and the ministry would deploy a team. Sometimes it's persons from the GPHC to go and observe those persons and do the necessary tests, because of course, the one thing that we advise people to do is that if you think you've been exposed, stay at home, call the hotline, call your healthcare professional, let them come to you. Do not go to the hospital, do not go to the health center where you can possibly infect other people. So the ministry has been doing their own monitoring, and in doing so, they would have picked up those additional cases.
Have you had any difficulty with persons adhering to these protocols? For example, those who would have already come in contact with the confirmed cases.
COVID-19 is new for all of us, and it has been difficult reinforcing for some people that they need to self-quarantine themselves if they feel they've been infected, if they feel they've been exposed. But I think people need to have a sense of personal responsibility as well as a sense of responsibility to others. And if they know that they have been exposed, or even if they think that they are showing some symptoms, like we say, stay at home, call the hotline, call your healthcare professional, seek some advice, self-quarantine and their guidelines for self-quarantining until you know for sure whether or not. And the only way you can know is if you wait the required amount of time, which is 14 days, to see if your symptoms develop. There have been issues with people not taking personal responsibility, and this is not for confirmed cases, but just people who might have shown signs and symptoms. And we just keep reinforcing that these people need to self-quarantine themselves and seek medical help from the hotline or from their medical professionals.
These cases were on Good Hope on the east coast of Demerara, and some persons on the east coast would have raised concerns about it spreading to that community. Can you say, as far as you're aware, what is being done to protect the residents there or to be in contact with them?
I do know that the Ministry of Health has been working along with the family of the woman, the first case that we did confirm. They have been working along with the family to ensure that the additional family members are being observed, that they're being responsible enough to quarantine themselves for the required amount of days to ensure that they do not come in contact with others. And the ministry as well as the hospital, like I said, we keep putting information out there. And I think if people use that information well enough, they're able to manage the situation in terms of the spreading of COVID-19. But for now, those are the intervention measures that have been put in place, monitoring the families that we know have come into contact, as well as sharing the information so that people know what they need to do.
Okay, and what systems have been put in place in terms of quarantining your own medical staff who came into contact with the first case?
So the medical staff who would have come into contact with the first confirmed case, we would have quarantined them. They are being observed by our other medical professionals, and we're handling that situation. We're ensuring that additional staff are being trained and prepared to deal with the different areas where those staff would have been stationed. And we're also getting help from other agencies to bring in additional staff so that when persons come to the hospital, we have the staff available to deal with them.
All right, and finally from me, the World Health Organization had up that we had 7 confirmed cases when it was 4. Can you explain what happened?
We have spoken with PAHO, and from what we understand, it was an error on the website. If people check the website right now, it does reflect that we do indeed have 4 cases, which is the actual information for Guyana. A few days ago, it reflected 6. And we can only imagine that it was a clerical error, because as far as we know, in terms of the tests that have been done and confirmed, as of this date, there are only 4 confirmed cases in Guyana.
All right, is there anything else you'd like to add?
Just to say to the general public that, like we keep saying, if persons think that they have come into contact with COVID-19 or that they may be infected, call the hotlines. The hotline numbers can be found on the Ministry of Health's Facebook page, as well as the GPHC Facebook page, and a few other places. Call the hotline, speak to the persons there to get some additional guidance and to activate a care plan for themselves and their families. If people have traveled, they recently to Guyana, or they're hosting visitors who would have recently traveled to Guyana, just be cautious. Be responsible, self-quarantine if it's necessary, make contact with the health facilities. Do not go to the health facilities and sit and wait and make contact with other people and possibly infect them. Just be responsible and practice social distancing, which we see now is the most the one measure that we highly advise for persons who think they may have been contaminated or infected.
Thank you very much.